Basically, for Fourier measurement, in the first phase, what we are doing, we are assessing the size and direction of the Fourier. Okay, that is our job. So how is it done? How is it done? Basically, Fourier measurement should be done before doing a cover test. Why? Because if you're breaking the fusion in while doing a cover test, so you will not get the correct measurement of the Fourier, right? So what are the tests basically we do in our clinic? We do a Maddox rod test to find out the horizontal or vertical Fourier. Okay, we can do a Maddox rod test. Is very easy. All of you know that Maddox rod test. We can do it for measuring the horizontal Fourier, like whether if there is any isophoria or exophoria, right? Also, if the patient is having any vertical Fourier, we can do with the Maddox rod test. And other things what we do for the assessment of Fourier is the Vongraphy Fourier test, what we have discussed in the previous class, right? So Vongraphy Fourier test, basically we do it in the phoropter. We do it in the phoropter and we can measure the amount of horizontal Fourier as well as the vertical Fourier, right? So if there is a cross, basically for measuring Fourier, if there is a cross diplopia, that means is it a exo or a isophoria? Yes. If we get a cross diplopia, no. Exophoria, if there is a cross diplopia, we get a exophoria. Basically, that is an exophoria. Okay. So how we do for Maddox rod test, the simplest way. So if you put the Maddox rod in the fused cylinders in the horizontal position, right? So there will be a vertical red line, right? And if you see with the other eye, the fixation light, so if the two lights coincides, means the red line is above the yellow light, then that means that is an ortho. That is an orthophoria, right? So if the red line is like this, if the red line is like this, and the light is in the other side, so we see whether the red line is on the right side or on the left side. If the so in front of the right eye there is a Maddox rod. So if the red line is on the right side, that means it's a uncrossed diplopia. So if the red line is on the left side, that is a cross diplopia. So if you get an uncrossed diplopia, right, what we'll do, we will put a base out prism to neutralize. So we'll put on base out prism from the trial box till the red line directly coincides with the yellow light, right? If there is a cross diplopia, that means the red line is on the left side of the fixation light, that is a white light. So that means you have to put in base in prisms to neutralize the same way. So basically we do these things for measurement of Fourier. We use this Vongraphy technique. We use the Maddox rod in our clinic. Maddox rod is easily accessible. So you can do a Maddox rod test for distance and near, right? And also you can, other things what we do is a Vongraphy technique. If we have a phoropter, we can do a Vongraphy technique. Now today I'll be discussing about this one, the Thoringtons method. Thoringtons method of measuring Fourier. So Thorington cards, basically, can you see the screen, right? Yes?
Yes, ma'am.
Okay. So Thorington cards and charts basically looks like this. Okay, you can see there is a vertical row of numbers like this, and central, there is a center part, there is a small hole. Similarly, there is another card which is having the horizontal row of numbers, and center there is a hole. So let's see this card. So you can see this image right here in the right side. You can see this zero marking is there in the center. All of you can see this. The zero marking is there in the center. So basically for Thorington's card, we have a small hole in the center. Okay. So if we are doing it for, like, it can come with a LED light setup. LED light setup, it can come with that. So touch on LED light setup is there, means if you are touching on the central part, the LED light will glow. That is also there. Or else we can use a pen light torch torch. You can see we have a pen light torch. You can get it from the market anywhere. So pen light torch, if you are holding in the behind the hole, so the light will be coming as a fixation light like this. Okay. Now you can see here from the 0 mark, what is there? There is 1, 2, 3, 4 like this on the right side. Similarly, in the left side, as well as above and down. Okay. So basically, if we use for Maddox rod also, we can use the Maddox tangent scale also. It also looks like the same thing. So Fourier measurement, if it is used with this, if their number card is there like this, so we can actually have a quantitative assessment. Basically, we need not to do a put prisms and all, and we can just have a quantitative assessment very easily. Okay. So very easy way I will tell you. This is like a Maddox or a Thorington card. So in the middle of there is a small hole. You can just put the near torch from the behind the card. Put a Maddox rod in the right eye of the patient. If you are assessing the horizontal Fourier, right, what you are going to do? The Maddox rod, the fuse cylinder should be in the should be in like this. The horizontally should be placed, and so that the vertical red line will be coming. Okay. Whenever you see a fixation light, if the Maddox rod is placed like this, the fuse cylinders in the horizontal way, in a dark room, we will be doing. So whenever a fixation light comes in front of you, what is happening? With the eye having the Maddox rod, will see a vertical red line. A vertical red line will be seen. The fixation light is a circular light, right? So a vertical red line will be seen with the eye having the Maddox rod, right? Now, right in front of the right eye, you have placed the Maddox rod and left eye is open. Now you have the number scale along with you. So suppose you are doing it from 3 meters, you are holding the card, or if you are doing from near 33 centimeter or 40 centimeter, whatever it is distance, if you are holding the card like this and the light behind it, okay, the patient will see a vertical red line and the vertical red line with the eye having the Maddox rod, right? The right eye, suppose we have placed a Maddox rod. So with the right eye, the patient will be seeing a vertical red line. And with the left eye, the patient will be seeing that yellow or the white light, right? So what will happen? The red line, if it is coinciding the white light, that means the patient is having an orthophoria. Is it clear to all of you? Any questions, any queries, please to ask. And stop me and ask anywhere. Yes. Any questions, any queries? Okay. So the yellow light is in the center. Red line will be seen by the right eye. So if the red line is falling on that yellow light, that is very well and good. It's the orthophoria. So now the red line is in front of the seen by the right eye, as the Maddox rod is in front of the right eye. So the red line, if it is on the other side, like the left side of the fixation light, so what is happening? It is a cross diplopia. So you can see on the number scale basically where the red line is falling. You can ask, this is a subjective method. Basically, this Thorington's card is a subjective method. Okay, the patient will report, you will ask the patient that where is the red line? If the patient tells it is just crossing from the 0, that means the patient is having a orthophoria. If the patient tells that this is on the right side, that means it's a uncrossed diplopia. If it is on the left side, that is a cross diplopia. So if the patient is reporting a cross diplopia, ask the patient through which number the red line is passing. Okay, you can see which number the red line is passing. So that number basically denotes the amount of Fourier. If it is a cross diplopia, what is that? That is an exophoria. Uncrossed diplopia is a esophoria. So these are the Thorington's cards, what I have shown in the previous slide. These are the Thorington's cards. So these Thorington cards and charts provide a very quick measurement of heterophoria. Why is it quick? Because the numbers are already there. So you need not to calculate with the help of the prisms. Okay. The near cards are used with a transilluminator and a Maddox rod, and they are self-aligning to the light for easy setup. A push-button central fixation LED light that turns on with a simple touch is also available as an option. Means, so the near hole, the central hole, we can fix a LED light. Okay. So it can be, the card can be an automatic one. So if you're touching the center portion, 0 mark, the light will be lighted. Okay. Or else what is happening, you can use a trans illuminator. Okay. That means you can, this is a trans illuminator. Okay. So you can see this one. This is a trans illuminator. So this, okay. Or else we can, so you just put that trans illuminator in that hole. So it will glow like a fixation light. Or else you can use a pen light torch, you can see. So these are all, trans illuminator is operated with a battery. Okay. So the light will be glowing in the center. Main thing is like, you can just, the card with the light, auto light you can have. Or else if you don't have that auto light, you can just put the trans illuminator over there, so that a light will be glowing from the center of the chart. Center of the chart means this 0 mark. This 0 mark, the light will be glowing from that part. That is the thing. The way you can hold, you can make it at home also. Like if you get this type of cards, you do not have a LED also, you can use your pen light torch. That is also easy to do. Okay. Is it clear till this? Any questions? Yes. Also, this Maddox rod is available in this slanting position. Okay. So slanting, this is a slanting, this one, not Maddox rod. This Thorington card is a slant Thorington's card. You can see that the numbers are in a like diagonally placed, right? So here also you can, the same way, the fixation light is there, and you can see this Maddox rod, the line, red line, vertical red line from the Maddox rod, which is crossing one number, and you will get the number. Basically, the reading, basically you will be getting. So scoring reveals how the scoring is done. Now this part, I hope you have understood how the test is being done. Now we will discuss about how the scoring in the Maddox, this Thorington cards. About the scoring we'll discuss. Okay. The scoring reveals if the patient has normal alignment when fusion is broken, or if the patient has abnormal alignment. Okay. अगर उसको नॉर्मल अलाइनमेंट है तो भी मिलेगा, अगर उसको एबनॉर्मल अलाइनमेंट है तो भी मुझे वो डायरेक्ट मेजरमेंट मिल जाएगा. The card has diagnosed uncrossed or crossed diplopia. That's what I was talking about. And right hypotropia, left hypertropia, right hyper, left hypo, all these things we can see it. As there is a 1 millimeter central hole, 1 millimeter hole in the center for the fixation light. So the light is in the center, right? So if the Maddox rod, okay, is falling on the right side or left side, it's a it's a horizontal Phoria. And if we are keeping the Maddox rod, the fuse cylinder in the vertical orientation, so there will be a horizontal line, horizontal red line will be seen, right? So we can measure the vertical Fourier, whether it's a hyper means above or it's a hypo. That's all also we can measure. Okay. So hyper, hypo, iso, exo, all we can measure, right? So with the near adult card, each optotype represents one prism diopters. So each optotype represents one prism diopter. So whatever number you seen, right? So it is a one prism diopter. So if the red line is falling at 1 means 1. If it is an uncrossed diplopia of 1, so it's a 1 prism isophoria. If it is falling on the other side on the 1, so it's a 1 prism exophoria. Okay. So plus minus 12 diopters means this side 12 diopters, this side 12 diopters will be there, so that you can measure till 12 diopters of Fourier. Is it clear to all? Okay. Is it clear to all? Yes or no?
Yes, ma'am.
Okay. Now this is the adult card. The adult card will be having plus minus 12 diopters, till plus minus 12 diopters on both sides. The card is 5.75 into 4.75 inches. Okay. And there is something called the pediatric card. See, for children, what is there? For children will have a larger amount of Phoria sometimes. Okay. So even this pediatric card, if you're using, okay. So for the near pediatric card, each optotype represents 2 diopters of Phoria and measures about plus minus 20 diopters. Okay. So each optotype will represent 2 diopters of Phoria. That is the thing. For adults, each optotype will represent 1 diopter of Phoria. For children, it will represent 2 diopters of Phoria. Now, for children, the numbers are not like this. You can see there is animals and all, so that the child can will be interested to see this animals or some signs and all will be there. Okay, so the child can see. The setup is the same thing. There is a either there is a trans illuminator, or else you can put a pen light like this on the through the hole so that it will glow, and you use a battery like this. So is it clear that this near measurement is clear to all of you? Hope so. Yes. So near measurement can be done at 33 centimeter. Wherever distance you want, you can measure the amount of Phoria. Okay. Now I'll talk about the distance measurement. The distance Thorington chart can be used with patients complaining of double vision while driving or other distance viewing. Basically, if the patient is having any complaint of a divergence insufficiency, or means he is complaining about focusing for distance and near, he trouble in focusing in distance and near, or he is facing a issue while driving a car, okay, or distance viewing, he is facing a issue. So that condition, we can use this one. We can use this distance Thorington cards. Okay. So the distance Thorington cards basically comes. Basically, it is seen like this one. This black color board you can see, right? So here is the same way. There is a fixation light in the center. Okay, it comes with a stand basically. Stand. Have you seen the logmark chart? Measurement of visual acuity in a logmark chart. So basically, it comes with a stand. You can. So it basically comes with a stand. So this stand can be adjusted to keep the chart at varying distances, right? For logmark visual acuity test, I hope you can remember. So basically, we can do it at 4 meter. If the patient can't see at 4 meter, we can bring the chart to 2 meter. And then also if the patient can't see, we can bring it to 1 meter, right? So same way, the distance Thorington chart is also the same setup. Okay, that same stand, it will with the rotating wheels at the landing position, it is there. So you can just bring the chart at 4 meter. You can do it at 2 meter, at 1 meter, any distance. If you are comfortable, you can do it. If the patient cannot see at 4 meters, suppose, you can bring at 2 meter. If the patient cannot see at 2 meter, you can bring it at 1 meter. Okay, the range of Fourier measured varies with the testing distance. So for ETDRS chart or the logmark chart, right, we have a log value and it changes with the varying distance. So 4 meter one part will be there, 2 meter another thing, like that. Here also the range of Fourier will be varying with the testing distance. The chart is 24 into 5 into 24.5 into 25.5. That is 62 into 65 centimeter, and fixed in a standard ETDRS cabinet. So what is an ETDRS cabinet? Where the ETDRS chart? ETDRS chart is also the logmark chart, right? So where the logmark chart can be placed, so that cabinet, so you can remove the logmark chart, you can put that distance Thorington chart as well. Now the distance Thorington chart includes a push button for central fixation LED light, that turns on with a simple touch. So you can just touch at the center, the light will glow. And now you can perform the same way the test. Is it clear to all of you? Any questions?